Chapter 16 covers the communication process. Communication is the exchange of messages between the sender and the receiver. There are different types. Oral is what you say, nonverbal is what you show, written is, of course, what you write down, and electronic is what you enter into the computer. Excellence in communication is essential in healthcare for a number of reasons. We have large, complex delivery systems. There's a need for intercommunications within those systems. We have very complex payment systems, and accurate communication is essential for those. We have patients spending less time in hospitals, and of course, the importance of patient education. Because chronic diseases have the largest impact on our health and are the leading cause of mortality, patient education has become even more important. We need to educate patients on how to prevent these largely preventable diseases and, of course, how to manage them if they become diagnosed. As part of communication, there's a need for respect and understanding of the individual patients and their needs. This can actually impact the speed of the patient's recovery. It's also important to note that your ability to communicate well depends on your attitude, and it's also very important to take into account that there are many stressors for patients which increase the anxiety levels, such as intimidation, fear, and anxiety. Poor communication can lead to fatal errors as well. The communication process involves more than just talking and listening. In healthcare, we describe this as therapeutic communication. Therapeutic communication is effective healthcare communication. Its aim is to meet the needs of patients, and it does require practice, developing and applying communication skills. These are the steps of that therapeutic communication process. Set your goals, create a message, deliver the message, listen to the response, offer feedback, and evaluate the encounter. Let's start with setting communication goals. You need to decide what should be accomplished during the communication session. Therapeutic communication is usually at a deeper level than your everyday casual communication. It must be clear and accurate, and the questions must be specific. Example of these goals may be gathering information, giving instructions, or reporting information to a coworker. In every patient interaction, it's essential that you show sincere concern for that patient's welfare, that you establish trust, enhance the patient's self-esteem, and also observe the patient and collect the following information: the patient's level of understanding, emotional factors, physical factors, and the urgency for the communication. The next step is to create the message. Create a message based on information gathered and the communication goal. You want to avoid medical terminology with most patients because it can be confusing, and use general language but not slang. You must be clear and accurate and organized. Typically, you rank items in order of importance and give an overview and then details. Breaking information into chunks can also help your patients follow it. The messages can be in forms of questions as well. Types of questions includes close-ended, such as what is your date of birth, something that can be answered with one word or phrase. Open-ended, such as why do you think you're feeling sad? It requires more than one answer. Probing is asking for more information. You said that you've been having pain in your stomach. Where exactly in your stomach do you find that you feel the pain? When is it the most severe? And leading questions are kind of like multiple choice in a way. They include the possible answer. Would you describe the pain as sharp, dull, throbbing, or aching? When asking questions, you want to make sure you allow time for response, and be careful with leading questions because sometimes patients just simply agree with you and choose one of the options. When necessary, reword questions. Humor can be used in patient communication when you are creating your message, but it must be used carefully. It can help relieve tension in some settings, and it may help promote discussion. It's also important to note that when patients joke, they may be masking their fear. So you need to listen and observe and determine if the patient needs some help dealing with that fear. The next step is delivering the message. You want to address the patient directly whenever possible, both young and more elderly, and you want to default to the more formal title, so use titles to show respect or ask the patient how they wish to be addressed. Take care not to breach confidentiality and maintain communication even with patients who cannot speak to respond. So, true or false, using casual words like and in your message to patients can help them feel more at ease? Not really. They can be distracting to your message and irritating for some listeners. Keep in mind that nonverbal communication delivers up to 70% of the meaning of an oral message. Nonverbal communication includes your tone, your touch, and touch can be reassuring, but be careful with its use. Nonverbal communication can include your body language, including gestures, both positive and negative. Smiling, crossing arms, and rolling eyes are part of nonverbal communication. Your facial expressions hold a lot of information for patients, so you want to avoid showing negative reactions like impatience or disgust. And of course, your physical appearance also becomes part of nonverbal communication. Leaning toward the speaker when you're listening is usually a sign of the answer is interest. Keep in mind when delivering the message that the physical environment can impact the delivery. So consider the light source and sound distractions. Make sure it's a private setting so that you can focus on the patient and evaluate the patient's comfort level too. Step 4 is listening to response. In healthcare, we call this active listening. It involves concentration, attention, and observation. Which is the most important characteristic of active listening? Taking notes, maintaining eye contact, or focusing fully? The answer is focusing fully. When you listen to the response, you want to show empathy. This is an effort to understand how other people feel. Walk a mile in my shoes, and you want to communicate your awareness of the patient's feelings. Step 5 is feedback and seeking clarification. This is a time for the receiver to check understanding of what the sender says. So some types of feedback are paraphrasing, which is rewording that sender's message, reflecting, which is prompting the receiver to complete or add to the message, asking questions, and requesting examples. I hear you saying you feel better after you've done the exercise I taught you last week is an example of, that would be paraphrasing. Finally, you need to evaluate the encounter to see if your goal was met, and if not, why. You need to continually evaluate communication throughout the encounter. Barriers can block effective communication, and examples of barriers are cultural differences, language differences, defense mechanisms, physical distractions, and pain. Now it's time for you to move on to the response to this mini lecture.